Troy Fink got the news just 6 months ago. He had diabetes, and it was serious. Troy knew he had to make some dramatic lifestyle changes.
Based on the way I felt, which was pretty bad, and the lab results that I had, I needed to make some changes pretty quickly or I wasn't going to live very long. That's what it looked like to me. And I have, fairly young kids, and I was feeling really bad, and it was getting to that point where I don't want to live this way anymore. I need to make some changes before I was even diagnosed.
But he also knew he needed help. He found it at Salinas Valley Medical Clinic's diabetes classes. Think of it as boot camp for diabetics. Once a week for 4 weeks, the class teaches everything you need to know about how to manage the disease. As a certified diabetes educator, Dana Armstrong is part teacher, part cheerleader, and part drill sergeant.
Getting the information and individualizing what it is you need to do for yourself and what works for you. I think working with a diabetes educator, working with a team of people who take care of patients who have diabetes, finding out more information, support groups, other types of things, classes such as this, I think it's a great way to then improve your health and take the fear out of diabetes.
Troy is one of an estimated 29 million Americans with diabetes. In the most common type, the body does not produce enough insulin, blood sugar, for normal function. Symptoms include frequent urination, intense thirst and hunger, weight gain, unusual weight loss, fatigue, cuts and bruises that do not heal, male sexual dysfunction, and numbness and tingling in hands and feet. It's a devastating disease that dramatically increases the risk for all kinds of other health problems, from blindness to kidney failure, heart disease, stroke, and the loss of toes, feet, or legs. And it is reaching epidemic proportions around the world. Looking at that list, Troy was frightened, but with Dana as his coach and armed with binders full of information, Troy made the commitment to change his life. From exercise to diet, Troy was all in.
Well, she looked at my numbers, and after giving me the crash course in, holy cow, you got to make a big life change, that helped motivate me to do what she suggested. I expressed to her how committed I was to making these life changes, that whatever needed to be done, I want to do it. I'm here, I'm here to do it. I'm committed.
No, I think education, that's the key.
Troy took all that knowledge to heart, and the commitment is paying off big time. Troy now eats a modified vegan diet, exercises regularly, and tracks his blood sugar 3 times a day, and he is seeing dramatic results.
Within 3 days of changing my diet, and I saw drops in my blood sugar numbers down to normal, even after being on the medication and not quite getting it there. And along with the exercise and the classes, I've been managing my diabetes, and I've just recently got off the medications, in fact. So I'm now to a pre-diabetic state and progressing towards eliminating it altogether, or putting it in remission, as she likes to say, which is fantastic.
Troy is feeling great. His energy is back. He's managing his disease, but he knows it takes a team, from the medical side to the personal side.
To achieve the results I've gotten, I couldn't have done this alone. My wife has been just a huge supporter. She's also become vegan, same day, just hardcore, fully committed to the same diet. My kids have been very supportive. I attribute that to my success.
The diabetes epidemic is staggering. 29.1 million people with the disease. 86 million people are pre-diabetic. Without weight loss and moderate exercise, 15 to 20% of those pre-diabetic will develop the disease within 5 years. And the total cost in medical terms and lost wages, $245 billion a year. The good news is much can be prevented or delayed with a healthy diet, exercise, and weight loss.